Hello everyone, welcome to our channel Pharma Guru. Today we are going to discuss about another major medicine used in case of blood clots, which is Pradaxa. What is Pradaxa? Pradaxa Dabigatran belongs to a class of anticoagulant medications called direct thrombin inhibitors. Dabigatran works by preventing blood clots from forming in the body. Pradaxa is used to treat blood clots deep in the body, deep vein thrombosis, DVT, and lungs pulmonary embolism, PE, in adults who have received blood thinners by injection for 5 to 10 days. Pradaxa is used to treat blood clots in children aged 3 months to less than 18 years of age who have been treated with an injectable blood thinner for at least 5 days. Pradaxa is used in adults and children aged 3 months to less than 18 years of age to lower the risk of a blood clot coming back after receiving treatment for blood clots. Pradaxa is also used after hip replacement surgery to prevent a blood clot deep in the body, deep vein thrombosis, DVT, or lungs pulmonary embolism, PE. Warnings: Pradaxa can cause you to bleed more easily. Call your doctor at once if you have bleeding gums, nosebleeds, heavy menstrual periods or abnormal vaginal bleeding, blood in your urine, bloody or tarry stools, coughing up blood or vomit that looks like coffee grounds. Many other drugs can increase your risk of bleeding when used with Dabigatran. Tell your doctor about all medicines you have recently used. Pradaxa can cause a very serious blood clot around your spinal cord if you undergo a spinal tap or receive spinal anesthesia epidural, especially if you have a genetic spinal defect, if you have a spinal catheter in place, if you have a history of spinal surgery or repeated spinal taps, or if you are also using other drugs that can affect blood clotting. This type of blood clot can lead to long-term or permanent paralysis. Get emergency medical help if you have symptoms of a spinal cord blood clot such as back pain, numbness or muscle weakness in your lower body, or loss of bladder or bowel control. Before taking this medicine, you should not take Pradaxa if you are allergic to Dabigatran, or if you have a mechanical prosthetic heart valve, or active bleeding from a surgery, injury, or other cause. Dabigatran can cause a serious blood clot if you undergo a procedure such as a spinal tap or receive spinal anesthesia epidural. This type of blood clot could cause permanent or long-term paralysis. Pradaxa can make it easier for you to bleed, even from a minor injury. Call your doctor if you have bleeding that will not stop. To make sure Pradaxa is safe for you, tell your doctor if you have ever had a genetic spinal defect, a thin tube catheter placed in your back to give you certain medicine, a history of problems with your spine or a spinal surgery, a history of difficult or repeated spinal taps, bleeding problems, a stomach ulcer or bleeding in your stomach or intestines. Take certain other medicines that can increase bleeding risk. Antiphospholipid syndrome, an immune system disorder that increases the risk of blood clots. Plan for surgery, or a medical or a dental procedure, or kidney disease. It is not known if Dabigatran will harm an unborn baby. Taking Pradaxa during pregnancy may cause bleeding in the mother or the unborn baby. Tell your doctor if you are pregnant or plan to become pregnant. You should not breastfeed while taking Dabigatran. Thank you for watching.